partnership meeting for, oh my gosh, we are in May already. How did that happen?
I don't know.
We decided to give Joe Halco a much-needed vacation, so.
Well, no, he's at a conference.
Well, they don't need to know that. We can make it out like he's having
on
a
the
good
beach.
time without us. He did not leave a name tag out, because he probably knows I'm prone to identity theft, so I cannot impersonate Joe Halco today. I'm Eric Peterson. I'm the Regional Director for Vermont Adult Learning, playing the role today. And we are going to start out with our usual going around doing introductions, who you are, who you work for, and one thing that you are grateful for right now. So we will start, let's go this way. We always go clockwise. We'll put John Gordon on the
put the
spot.
heat on me counterclockwise.
And you got 20 seconds to
20
do it.
No, 30 seconds. 40
No,
seconds.
it's 40
It's
seconds.
40
You get
seconds.
20.
Oh, I was trying to be more efficient to
20
show
seconds
Joe
arguing about how much
that
time I have. John Gordon, Sheldon Methodist Church Food Shelf, and a member of the PELT, and yeah, I'm thankful for pickleball. My brother been after me all winter long to start playing pickleball, and I started 2 weeks ago, so I played 2 rounds, so round 3 maybe Friday.
I was so hoping I'd get to.
Try to ding me out. Okay, no way. On to Mary.
All right, so my name's Mary and I work for the Vermont Department of Health, Division of Substance Use Programs. It's only 5 months in the making. It's maybe another 10
Very
years.
smooth.
And one thing I'm grateful for is I had surgery on my eye that has restored my vision.
Ooh.
That's awesome.
Amazing.
Nice.
That is
I'm
good
gonna cry
news.
because it is life-changing.
Wow.
Awesome.
Congratulations. My name's Michael Brusso. I actually work for Indivior, but I don't work in promoting. I work in trying to help support MAT programs for people with opioid use disorder across Maine, New Hampshire, and Vermont. And it's a bit selfish, I guess, but I'm very grateful for my family and my puppy dogs.
Aww.
Love the puppy dog.
Yeah.
Is this your first time here?
It is.
Oh, you got the happy.
And at the end, you have to sing a song.
And a dance.
I got the wrong shoes.
We have a couple of the new people, so you won't be singing alone, you won't be solo.
My name is Stephanie. I work for Vermont Psychiatric Survivors. I'm a peer advocate, and I am grateful for my chickens and my family and community.
You've been here before virtually.
Virtually,
right? Okay,
yes.
very good.
My first
Yeah.
name.
Sorry, you don't get a bell.
She did no bell, no singing, no bell, no singing.
Fine.
Good morning, everyone. I'm Devin Bevins with the Vermont National Guard Prevention Workforce, and I am grateful for ibuprofen today. I spent 2 days contorting my body painting, and I am feeling it. Yeah,
It's gonna look beautiful.
it is beautiful. It looks awesome.
My name is Jenny Stevenson. I work with Devin in Vermont National Guard, and I'm grateful for my family coming up here to visit me on Mother's Day weekend. So.
This your first time?
It is her first time.
Everybody works in my house, so. By myself.
And around to Faith.
Hi, I'm Faith. I am a community health worker with the Abenaki Nation of the Missisquoi, and I'm very grateful that our dog did not lose her eye recently. Not so grateful she's earned herself a lifelong ophthalmologist, but her eye is trending from white back to brown, so we're very happy.
Okay.
Yes.
See, eyes are important. My name is Amy Brewer. I coordinate the Franklin Grand Isle Tobacco Prevention Coalition. I'm a health educator over at Northwestern Medical Center, and my side gig is I help coordinate regionally safe routes to school programs here for Local Motion. And I am grateful for sharing with others. I'm grateful for really bright clothing on days when it's raining again. Like Faith, put on something bright and fun to boost my mood, which was not great.
All right.
You look like you're wearing all black.
Very bright skirt.
Oh no, the skirt, there we go. Okay, all right. You're excused.
Thank you.
I'm Crystal Lampman. I'm the Executive Director of Franklin County Caring Communities, and I'm grateful for our teachers. My kids were home all last week and were very bored for the entire week, so I was happy to send them off to incredible teachers this week.
I'm Brad Ferlin, sort of independent, but do a lot of recovery work, and I co-chair a substance use addiction summit with Melinda that we'll have our second summit at the fairgrounds this summer, which will be exciting. And I'm grateful for Melinda, and she's an awesome partner on this. She's been amazing. So.
Wow. I slipped him a 20 to say that one.
Is this your first meeting?
It is? Yeah, it is.
It
the
is.
first time.
If
You wanna
there's
do
singing
the-
involved, they'll need the mental health counselor.
You want to do the virtual folks?
Yeah, let's do that. Okay, so we're gonna hop to people who are on Zoom virtually. I'm gonna call you off as I had documented you when you joined, and in advance, my apologies if there's anybody I miss. When I get to the end, we'll make sure everybody gets called on. First person I had is Michelle Williams-Bissett.
Oh, you muted yourself.
Muted.
Michelle Bissett, Franklin County Caring Communities, and the Abenaki Nation of Missisquoi for domestic sexual violence. And Bandit wants to say hi to Crystal and Amy this morning. Grateful for family, friends, and some nice weather.
Awesome, thank you. Next person is Matthew.
Greetings, everyone. My name is Matthew LaFleur. I'm a board member of the local nonprofit Albert Family Clubhouse, but I also, across Vermont statewide, 13 subcommittees, so I get very, very busy. But, what I'm grateful for is, understanding the discussion and conversations we have with, our communities about the problems across Vermont statewide. And I'm, honored to be helping communities that need the help, to understand that, everybody's access needs should be met, regardless. Thank you very much.
Wonderful, thank you, Matthew. Next person, Adam Kirsch.
Hi, I'm Adam Kirsch. I'm a public health specialist, chronic disease designee at the Vermont Department of Health and the St. Albans District Office. And I'm grateful for my partner and our dog.
Love it.
This is Adam's first meeting.
Oh, is this your first
time.
meeting? All right, a virtual song and dance. Okay, next person is Marianne. You say grateful as partner and dog.
Good morning, I'm Mary Ann Damasio. I work with the Community College of Vermont in St. Albans and Winooski, and I'm so thankful for my health. All of it, physical, mental, all aspects of my health.
Love it, thank you, Marianne. Next person is Amanda. I don't see a last name.
Hi, I will work on that. My name is Amanda. I'm a community health worker at the St. Albans Health Center. And I am thankful for the warm weather that's supposed to be coming this weekend.
Wonderful, thank you, Amanda. Next person, Haley. Is Haley still there?
Yeah, I have a microphone set up.
Yep.
I am Haley Burrington.
Okay, community. Okay, so, hi everyone, I don't have a microphone set up. I'm Haley Burrington. I'm a community health worker with Notch. I'm thankful for the upcoming spring weather and being able to get outside to enjoy. Thank you so much, Haley. Next person, Jessica.
Hi, I'm Jessica Moore. I'm the minister at First Congregational Church of St. Albans, and I'm grateful. We are part of a community collaborative of faith communities and civic communities called the Welcome Home Initiative, and we provide apartment basics for people who are getting housed. And the local, our Franklin Grand Isle Quilt Guild, just donated a bunch of quilts from their Comfort Quilt. I guess I would call it mission. That's a church word, but they give comfort quilts to people, and we have all these colorful quilts now to give out to folks who are moving into housing, which is really exciting.
Wonderful, thank you.
Jessica, I've got some food I'll drop off at church when the meeting's over.
Great, thank you.
You're at church, right?
Yes, I am at church. Yep. Thank you.
All right, Jackie?
Hi, I'm Jackie. I'm the emergency preparedness specialist in the St. Albans Office of Local Health. And I'm grateful that yesterday a few of our Medical Reserve Corps volunteers got a 2023 MRC recognition award from the U.S. Department of Health and Human Services for outstanding preparedness and resilience volunteers. So I thought that was really great. It was a national award, so very exciting.
Wonderful, thank you. Next person is Alex.
Me? Alex. I'm sorry, I missed the prompt.
Oh, just your name, who you work for, and one thing you're grateful for.
Alright, hi, I'm Alex. I work for Safe Recovery as a program assistant. And I am grateful I get to do this kind of work.
Awesome, and this is your first meeting, correct?
This is my first meeting.
Welcome.
For those of you on Zoom, if it's your first meeting, please put your name and your organization and your email address in the chat so we can capture it to you get put on our secret list.
Thank you for that.
It sounds so ominous. It's our happy list.
Insider. You become one of the insiders.
Thank you for that. Yeah, usually I say that at the beginning too. So if it's your first meeting, put your email address in the chat so we can add you to the listserv. And for people in person, we're passing around the sign-in sheet. So if you can make sure, again, if it's your first meeting, to put your email address. Next person is Jen.
I am Jen. I'm the RN care coordinator at Notch Primary Care. I am thankful for my office buddies.
Love it. Thank you. Kylie. There she is.
Is that working?
Yeah, we can hear you now.
Hi, I'm Kylie. I am the other RN care coordinator in the St. Albans office, and I think this is the second time Jen has stolen mine, but I was also going to say that I am thankful for my coworkers today because they made me laugh nonstop. So.
Wonderful. Thank you. Next person is Beth.
Hi, I'm Beth Burgess with Vermont 211, and I'm grateful to be almost finished with grad school. I graduate later this month.
Congratulations. Next person, Erin Creeley.
Hi everyone, I'm Erin Creeley. I'm the District Director of the St. Albans Office of Local Health, part of Vermont Department of Health. I'm glad to be here, and I am grateful for springtime, all of it. Thanks.
Wonderful. Thank you, Erin. And the next person is Courtney.
Hi, good morning everybody. I'm Courtney O'Brien. I'm the Quality and Practice Facilitator for the St. Albans Health Service area. I work for Northwestern Medical Center, but I'm part of the Blueprint for Health team. And I am jumping on the Thankful for My Dogs train. I currently have 5 in my house right now, so I'm feeling a little crazy and just reminding myself that I'm thankful. And no, I'm not, I am a crazy dog person. They're not all mine. I'm dog sitting and I foster for rescues, so.
Aww. Great, thank you. Next person, Megan.
Morning, everyone. Megan Bridges, United Way of Northwest Vermont. I'm a community impact manager here. And I am, even though I'm not there today, I am very thankful for all the opportunities lately that I've had to get out and connect with folks. The Howard Center Conference amazing. I've been to some awards luncheons that haven't happened in several years lately, and it's just wonderful to see folks in person and connect with several of you recently. So, yay!
So good to see you, Megan. All right, next person, Ali.
Hello, this is Ali Yang, BDF Regional Manager covering Franklin, Grand Isles, Chittenden, and Central Vermont. I am thankful for the spring. Thank you.
Thank you. Great to see you at the conference too. Erin O'Keefe.
Hi folks, Erin O'Keefe from Safe Recovery at the Howard Center. This is my first meeting and I'm excited to be presenting today. And I just got back from a great vacation, so I'm feeling really darn grateful for that. Nice to be with you all.
Party hat and bell, welcome to your first meeting. All right, Ben.
Morning, folks. Ben Kaufman. I'm the program director at Samaritan House, and I'm just really grateful to be where we are. We're rolling out a couple of our annual fundraising events, and it's so much fun to reach out with the initial rollout, just because I think we touch every corner of the county, and just really grateful to be in this area doing this work.
Awesome, thanks, Ben. Denise.
Hi, good morning, everybody. Denise Smith. I'm the Blueprint Program Manager for the St. Albans Health Service Area and Director of Population Health at Northwestern Medical Center. I'm grateful for so many things, but really I think the main thing today is just that I get to do the work that I do with all of you, so thank you.
Awesome, thank you, Denise. Is there anybody else on Zoom that I missed?
I had a Kim Atkinson, but did she drop off? Did she drop off? Because I don't see her.
She must have. I didn't see her to put her on my list. Okay, thank you all, and I guess we'll hop back in the room. So my name is Melinda White. I am with the Howard Center, Northwest Spoke in St. Albans, also a recovery coach in the emergency department, and I won't list all of my board paths at this time so we can get to business. I'm
Are you
grateful
challenging Amy Brewer for the longest
okay,
title?
Police Advisory Board veto.
I don't want it.
And I'm grateful for all the people I work with. I'm extremely grateful for Brad too. Working on this summit, this is our second annual at the fairgrounds. It's technically our third summit. The first one was in Montpelier, but the opportunity to connect with all of you, and I know many of you have already had me reach out to you about the booth registration. We're going to be getting the link out soon, but you know, last year we had almost 90 booths, right? So from not just the state of Vermont, but some partners that are in New England altogether, had some fantastic summit presenters. We've got a few lined up, well, multiple lined up for this next one. And I mean, these are rock stars, and what I love about it is having started as a grassroots event, it gives us really that, I don't want to use the word control, but to be able to relinquish control over rules to a degree where people can come at any time. You can set up, if you can't stay the whole time, no problem. Network as you want. Like, it's just really this, you know, authentic recovery community atmosphere and an opportunity to hopefully reach the public even more than we did last year. So we're going to be hammering out on the marketing and publicity on it. So people do know if they want help, we'll have some providers that can give them on the spot support in addition to collaborating with our partners. So I'm excited for that event. And for all of you here, and for Eric, who's so graciously stepped in for Joe to facilitate this meeting. That was more than 40 seconds. Thanks for not
That's
timing
okay.
me.
I cut you some slack since you're multitasking. I'm Eric Peterson. I am the Regional Director for Vermont Adult Learning in Franklin Grand Isle counties, again playing the role of Joe Halco today, who got called away to a conference. I guess, I'm grateful for, as some of you know, I've been recovering from a ACL reconstruction and 3 meniscus tears, and as of last week, I finally got full range of motion back in my leg, so I'm just retraining it to walk again with my new ACL. So big shout out to the folks at Excel Physical Therapy here in St. Albans, who've
Awesome.
been doing a fantastic job with me.
Do some typos soon.
Yeah. So, I think that is it. We've got everybody on introductions.
Roller derby.
What's that?
You'll be doing roller derby again soon.
Oh, I
That's how we
coached the
entered it.
Green Mountain team
All
last
these dogs
weekend.
and cats. Next month, I'm going to bring a beef cow to the meeting. Okay, good. You know, you got all these dogs and cats.
Okay.
Need some all
Pet cows.
Somebody can bring a chicken. Somebody have
Okay.
chicken. What chicken? Who was that? Chicken. You bring a chicken, I'll bring a beef cow.
I want to see you on Zoom with the cow in your living room, petting it. Oh, wait.
Okay.
All right,
minutes.
let's move on to the approval of the April 5th meeting minutes. They should be in your packet, and they were emailed out last week. So if everybody could take a second to look at that. And do we have a motion to approve the minutes? Crystal, and do we have a second? And Mary, second. Any changes or anything we didn't get in there? All right. So we have a motion and we have a second. All those in favor of approving the April 5th meeting minutes, say aye.
Aye.
All those opposed? And the ayes have it. The minutes are approved. So we're about to get, what's that?
So one thing I'm just going to mention, the meeting is, I'm going to be recording it on Zoom once we get ready to introduce our presenters. So just to answer that, I also saw Matthew had put in the chat asking if it was being recorded, and I said when the presenters come, but now I'm being reminded that this is our second month having Northwest Access TV. So it has been recorded this entire time, and I apologize for the confusion there. But I'm going to be hitting record on the Zoom now, so I just don't want people to be jolted by that.
Recording in progress.
There you go. Okay, so do you want me to introduce our presenters?
What, yes.
Okay,
You know.
so I am extremely excited today, and I know I'm slightly biased because being an employee of the Howard Center and having been a big fan of Erin O'Keefe for many years, really excited for today's presenters. It looks like Erin and possibly Alex is going to be doing this presentation with you. So I'm going to turn the floor over to Erin. You also should have screen share ability, Erin, so just let me know if there's anything that you need. Otherwise, I'm going to turn this meeting over to you for the low barrier mobile van presentation.
Wonderful. Thanks so much, Melinda. I want to fully acknowledge that I sprang this meeting on Alex about 10 minutes ago, and this is her second week working. So I'm really grateful for her to be joining us today, but you know, she's just sort of soaking it all up, but glad that she's able to say hello to everyone. I also want to acknowledge that I was really hoping that we would be able to be there in person. My colleague Arnella Groich was planning to come up this morning, and unfortunately she has strep, so she wasn't able to make it. We also had printed some flyers to kind of give to those in the room that obviously didn't make it to Franklin County this morning, but I'll make sure they make it there by the next meeting so that you all can kind of help us distribute and promote this project. Great, so really grateful to be here. I know we've been on this agenda waiting for this meeting for many moons, so excited that it's finally arrived. I have a few slides prepared, but I also just really want to take the time to you know, talk about the project and answer lots of questions. So we can kind of start with what I've prepared, but please feel free to interrupt me, and I'll also leave time for questions at the end. All right, so this project has kind of a few different arms. One of the arms is that we are the lucky recipients of a federal grant, a 5-year federal project, which is allowing us to expand the safe recovery model of combined syringe exchange and low barrier access to treatment into both brick and mortar and mobile sites in St. Albans. The second arm is that kind of as preparation for this, we received, and independently, we received health department funding along with the other syringe exchanges across Vermont to expand mobile exchange. So what's happening now is really not funded by SAMHSA, but is funded by the health department, which is an expansion of mobile syringe exchange, which has allowed us to better serve Franklin County. We will be building on that model in the coming years to offer this combined structure of treatment. All right, let me do a screen share.
and we can talk a little bit more about the project. There we go. All right, so the title of our SAMHSA project, and it's a Matt Padoa grant. Some of you who have been familiar with SAMHSA grants in the past may recognize that type of grant. The intent behind this SAMHSA series is really about expanding access to medications for opioid use disorder in response to the national opioid epidemic. And fundamentally, it's a services grant. This is about delivering services, MOUD, to people. Our kind of main grant goals are around increasing the number of people who are receiving these medications, as well as decreasing the illicit use of opioids and other prescription medications at the 6-month follow-up. So we have collect data with participants at intake, 3 months, 6 months, and 9 months. And along with those kind of survey-based data, we're also collecting urine-based data so that we can kind of demonstrate the effectiveness of this type of treatment model. As I mentioned before, we've been operating a low barrier spoke treatment program out of the Safe Recovery office since 2018. I am the coordinator of that program. We have about 100 clients enrolled in treatment here on Clark Street, and it is kind of a co-located program. The syringe exchange on Clark Street, the Safe Recovery Exchange, has been open for almost 20 years and has a lot of established presence in the community of people who use drugs in Burlington. What this model offered was the ability to have on-site direct referral for people who have established relationships with syringe exchange staff, who utilize that for case management as well as clean supplies, and are able to build that relationship. And when they're interested in making a change, that we're able to say, hey, actually, my colleague is right upstairs. Let me pull her down. I can introduce you. We can get you into treatment today. We offer same-day medication. So the idea is that we are as low barrier as possible. And we really target kind of a specific subsection of folks who are involved in the hub and spoke system. And I'll kind of get into that in a minute. The low barrier has become a little bit of a buzzword. You know, we use it when we talk about housing, we use it when we talk about treatment, but I think it does help to spend a little bit of time breaking down what we're talking about, what I'm talking about when I talk about low barrier. And I've kind of distilled it down to these 6 things. What I mean when I say we're offering low barrier services is that we're offering treatment on demand. That someone is able to walk in or as close to possible to the time that they present asking about treatment, that we're able to screen them for appropriateness and offer them an appointment as quickly as possible. That it's really a speedy process without a ton of barriers or appointments weeks in the future. That if someone is identifying that today's the day, that we take them seriously. That we say, today's the day, let's figure it out with you. This is a medication first model. And what that means is that, you know, in treatment programs in the past, a lot of times there were many kind of administrative barriers to making it to your first dose of medication. So you'd be asked to come back many times to complete program intakes and psychosocial assessments before you're getting that first dose of medication. And the problem with this is that people are in withdrawal, they're not feeling well, they're also engaging in very high risk behaviors. Folks who are not initiated on MOUD are at enormous risk for overdose death. So we're actually by delaying the onset of providing them medication, we're increasing or at least, you know, elongating the time that they're at risk to die of an overdose. So if we can really look at what are our administrative processes and how can we distill this down to the simplest possible intake and make sure that you are dosed with medication today, that you have that on board, that you're safer now than you were before you came in, and worry about the psychosocial assessment next week or tomorrow. That we're, not saying we don't need those things, but that we're really prioritizing how do we keep this person safe, reduce their risk, and help them engage in treatment as quickly as possible. That kind of leads me to the next point, which is around having an engagement and retention focused mentality. That we're really working to kind of set up a treatment approach that's working for people. That if they're identifying barriers to their care, that we're taking those things seriously, and working with them as much as possible to create something that's working for them. A lot of times we hear from folks who have been to the Hub, BART, or the Chittenden Clinic in the past, and there might be a lot that's going well for them there when they can get there, but transportation is a big barrier. If someone says, transportation is too hard, I can't go back to the Hub, then I think that's really something to talk about. And how can we, move them to a spoke environment, or offer them a spoke environment. We don't typically take referrals out of other treatment programs, but offer them a spoke environment, and really work on telehealth options or rides from case managers, helping them to set up Medicaid rides if that's possible. So that we're just making sure that we're really targeting the things that will make the difference to people staying in treatment. The other thing, and kind of the hallmark of this program, is that we have a flexible appointment structure. We do offer appointments, but to the vast majority of folks, that's just not really how we operate. We keep kind of a rolling list of when people are due for medication refills and who we're tending to expect on a given day. But in general, people can walk in whenever they need to. If they're out of meds, they come back or reach out, give us a call, and we are able to set something up quickly for them. But really, our whole program is structured around offering flexible appointments on a walk-in basis for people who are our patients. The other hallmark is that we do not discharge for use, essentially full stop. We retain people in treatment who are at action for their opioid use, don't want to die of an overdose, but may have a lot of ambivalence about their continued cocaine use, or may not be interested in stopping using methamphetamine. And we really wholeheartedly believe that just because someone is struggling with stimulant use or an alcohol use disorder doesn't mean that they are unworthy of receiving treatment for their opioid use disorder. I think the kind of container of this is that this is a medication program, and we need to kind of continue to monitor to make sure that someone is using their medication in a safe way, that they're taking their medication. But as long as someone is able to take their buprenorphine or talk to us about it and make a plan to get back on it if they're using fentanyl, then we can retain people through those periods of substance use. We have folks who are really striving towards abstinence, and we also have patients who that's just not the goal in their life right now. And the harm reduction philosophy here is that they're safer if they're taking their buprenorphine. The other kind of quintessential part of this is that additional supports are optional. So we have counselors, I'm one of them. We also have another counselor on staff. We have case managers. We can offer robust wraparounds, but that's not for everyone. And sometimes people want to come and meet with their medical provider and leave, and they're just not interested in tackling the other stuff that's going on for them. And that's someone's right. And we want to respect their right to self-determine what level of service engagement is right for them. Okay. So I mentioned a little earlier that, this is a little bit of a radical model, not without precedent. There are several low barrier programs popping up in Vermont and across the country, even co-located in syringe exchanges, which is amazing to see. But we are really targeting kind of a specific portion, a specific population within Hub and Spoke. And that is one, people who have really struggled to retain in other types of treatment. If they have been to the Hub, you know, and it just didn't work out. They couldn't get there, they stopped going, they returned to use. Maybe they've been discharged from a primary care spoke program because of missed appointments or use. Those are really the folks who we're targeting, people who have tried more traditional routes of treatment and for some reason it's not working. That also may be that they have other psychosocial stuff, psychotic disorders or other things, mental health problems that are prohibiting them from standing in a dosing line. So kind of a subset of the population who might be a little bit more, who may be struggling in a different kind of way. And I see my second number one point here is, you know, folks who are seeking an immediate access point to the larger system. So we do a good amount of bridges to other types of programs. You know, if you're familiar with MOUD screening, you'll know about the treatment needs questionnaire, which is a very common way for Hub and Spoke to kind of assess severity in about 23 questions. We do use the treatment needs questionnaire as a screening tool to kind of gauge when someone walks in the door, is this a person who really needs a low barrier approach, or could they be successful in a different type of program? And if it's the latter, we make those phone calls, set up appointments in primary care or you know, other types of spoke programs very frequently. I think that's a little bit of a difference between Chittenden County and Franklin County that I've noticed as we've launched this program, just in terms of the array of different types of spokes available. So we've seen a little bit less kind of bridging to other programs in Franklin County as we've gotten started. You know, additionally, Howard Center in St. Albans offers on-site kind of both the low barrier approach and a more traditional spoke program. So they're actually doing kind of an internal sorting of who is on the, Chris Smith calls it the low barrier bike lane versus kind of the general population spoke program. All right, so how we've kind of conceptualized how this works. And I think maybe it's good to just pause here and say that we have been able to implement a few aspects of this, but it's not fully implemented yet, and I'll sort of get to why. So this grant funds the continued enrollment out of Safe Recovery on Clark Street in Burlington. We have also been enrolling for over a year into this low barrier project out of the brick and mortar site at 172 Fairfield for the St. Albans Howard Center office. So that's been wonderful. I think we have about 40 enrollees in low barrier at Howard Center North. And then kind of the thing that we're still working towards is offering this service via a mobile unit where someone will be able to induct onto buprenorphine, see a medical provider, actually aboard a van that will have rotating service days across Franklin and Grand Isle County. All right, so kind of a little bit of just a matrix of how the workflow goes here, just to kind of break it down a little bit more. All right, so a person presents for treatment. They can do that either to our Burlington office, our St. Albans office, or in the future to this mobile unit. Then kind of based on what's the best fit for that person, location-wise, they'll become a full-time patient of one of the brick and mortar sites. And receive that continued assessment of, is this the right place for someone, or should they be seen in a more traditional spoke program? All right, so this is the schematic for the custom mobile medical van that we have ordered. You'll see that it does kind of serve that dual purpose, the needle exchange portion, and then an office on board where we have a bathroom, can do urine analysis. it's set up with full telehealth capacity, good for counseling. Also, we anticipate having medical provider on board. So it will be fully equipped for both the medication for opioid use disorder service delivery and the syringe exchange service delivery. Unfortunately, as you all have experienced, the global supply chain has been really wacky the last couple of years. And we ordered this van over a year ago. We ordered it in January 2022 after months of research. And we've just encountered a lot of ongoing delays with the delivery of this van. You know, it's a Ford. Ford Motors essentially stopped making vehicles last year. So at this point, the expected delivery date isn't until January of 2024. So we're sort of waiting, hopeful, and also trying to, you know, get some movement going in terms of launching the MOUD portions, mobile portions, as soon as we possibly can. We do, however, own a Sprinter van that does mobile syringe exchange in Franklin County now, and we're working towards expanding that. I'll be able to talk a little bit about what's going on with that now and what we're anticipating in the next few months over the summer. All right, so here's some kind of, you know, that was the schematic, and here's essentially what the inside will look like. So, you know, a mobile vehicle that you can board. And I think that was really important to us when we did the purchase, that these are confidential services. People need to be able to not do them in the open air, but actually get on board a vehicle where they can have some privacy. And then it'll have 2 different rooms inside for 2 different services. All right, so what's happening now? As I mentioned, we have a Sprinter van that is doing 2 days of services at different sites in St. Albans. So right now we're doing 2 days of services at 172 Fairfield Street, a couple of hours on Tuesday and Thursday afternoon. The van is open for harm reduction and syringe exchange services at the Howard Center office, and then also at the Cadillac Motel. We had a lot of momentum going to expand beyond just these 2 sites in the fall, and then sad for this project, but lucky for us, the case manager who had been managing the van was promoted, which is wonderful. She's a great fit for our exchange supervisor. However, it meant that we were kind of stuck in the holding pattern of really just delivering mobile syringe exchange 1 day a week, 2 days a week, and just in St. Albans. However, we've hired a new case manager and they are starting on Monday. So I really do anticipate we're really excited and anxious to add more sites and more services and also get out of St. Albans. That the goal of this project is to, you know, increase services to Enosburg and Richford and get into the islands, and we're really hoping to do that. So one of the ways that we've kind of conceptualized how to get the word out and make sure that clients have the most up-to-date information about what are the hours of the van is that we have this phone number that you can call that has a recorded message of where the van will be this week, dates and times, so that if there's a change, if someone's sick, when we're adding a new site, that information can be disseminated as quickly as possible. I also mentioned posters that I was hoping to get to you all today, but I'll make sure you get them in the future. That we're going to, you know, start more active promotion of the van. And we've developed both service user focused posters and provider focused posters. And if I get out a full screen here. All right, so this is the provider focused poster. Just gives a little bit more information and that phone number about what types of services that we're offering aboard the van, mobile and confidential syringe exchange, Narcan, every syringe exchange interaction, we always offer Narcan. We also have fentanyl and xylazine test strips that we're able to offer. Service navigation, so if someone is interested in making their way to treatment or needs hepatitis C testing, that we're able to make those referrals and really talk through the barriers with somebody. So those case management services, how are we helping someone to navigate what they need in addition to just offering clean supplies? And this one, very similar, but in a little bit more plain language, we've developed with our service users in mind. So this program offers syringes, injection supplies, Narcan, test strips, all free and anonymous. For those of you who may be less familiar with syringe services, everything is done through an anonymous code. Many of the folks who utilize that service, we do get to know over time, know their names and their stories. But if people prefer, they never have to give a name, not even during intake. Everything is done through an anonymous code. When they present to pick up supply, we ask for their code, write that down, and are able to give them what they need totally free of charge. So it's really quite anonymous and holds to a very high standard. These accessing of the syringe exchange is never included in someone's medical record. There's no tie or acknowledgement that they were the person who used the service, other than a code that's totally de-identified. All right, so let me sort of pause there and ask you about your questions.
I don't have a question. I just want to validate what you're doing. I think it is so amazing. I love the lack of judgment and the care of the community. It's just amazing. Thank you for sharing.
Yeah, thanks so much.
One question here, when you get the mobile van moving, like when you go to a particular spot in the community, how long do you plan to stay there? Like for a few, you set up a spot where you're going to be in a certain spot for several hours or the whole day, or?
Yep, great question. So our intent is to set up kind of fixed sites where we'll be on a regular rotating basis for a couple hours at a time. So every Monday we are, in this parking lot from 2 to 4:30, something like that. I think one of the real successes of the Burlington syringe service program is that the hours are predictable. People know how to access it. And we're hoping to kind of build on that concept by really making sure that people know what to expect of us and building, that reputation over time. So we don't want to be, I think one of the reasons we've been hesitant to add new sites too quickly is we want to just really make sure that we're establishing and maintaining the ones that we have and are being very predictable, so that we can be relied upon.
Are you looking for spots now here in Franklin County, other spots, or are you?
Yeah, so, we are looking to add spots and we have a few in mind. We have a spot identified in Enosburg that I think we're planning to expand into in the next couple of months once our van case manager kind of gets up and running and is able to be more independent. I think we would likely be interested in, adding a site or two to our St. Albans days. We're really interested in adding a site in Allberg and are hoping to figure out the best place for that. We're hoping to add a site in Richford. So yeah, I think we are looking for spots. So if you have ideas or have a spot, we're very interested in hearing about that. And I also think we're really trying to strike a balance in our siting between places that are easy to access, but also have a level of confidentiality. Parking on a main street where everyone can see the comings and goings doesn't seem like the best plan to make folks feel comfortable. So just kind of really trying to balance those things.
I see Matthew has a hand up too. Matthew, if you want to unmute yourself, you're welcome to.
Yes, thank you. Yes, and thank you for bringing that up. Yes, Alberg has a couple of sites that are like close on by, but out of the way, and and Grand Isle County has that too as well. I mean, we have plenty in my town. We have plenty of sites. Just have to get with us and see what's more convenient for you, because it's and the patients and the individuals that live in this town for accessibility purposes. We just want to make sure that not just Grand Isle County is more accessible to your organization, but everybody involved. Thank you very much.
Thank you, Matthew.
Matthew, it seems like you have a couple of, that you're thinking about particular spots when you're talking about those communities. And would it be okay if I followed up with you to kind of pick your brain about what are the sites that you're thinking of?
Yes, I am. People come to me to ask questions about, certain sites, certain, discussion, conversation, and recommendations and suggestions of where, my minor track is going forward for communities, not just in Franklin and Grand Isle County, but across the state of Vermont too as well, because they want someone that actually understands the problem and try to address their concerns. Thank you very much.
Yeah, thank you. I see Jackie.
Hi, I just had a question. I just wanted to ask if the van that you will be getting, if that is going to be accessible.
Thanks for asking. It's not wheelchair accessible, unfortunately.
Hi, sorry, as a follow-up to that, just curious, this is Erin Creeley. If it isn't wheelchair accessible or accessible for folks with other mobility aids, is there thinking through or an interest in thinking through how services could be provided in a confidential way for folks that do have accessibility needs?
Yeah, thanks so much for raising this. I really appreciate it. I think that because we haven't made it to that phase of the project yet, we likely haven't given it enough thought. So yeah, I appreciate the question. Our partners, Vermont Cares, one of the services that they offer to Franklin County is delivery of syringe exchange supplies. And I think that partnering with them to make sure that we're able to serve people who aren't able to access our service, whether it's because of a mobility issue or a transportation problem, has been something that we have been working on. We don't conceptualize this program as delivery of supplies, but that's something that they do really well and have a long-standing relationship with Franklin County where they do deliver supplies to people. So hopefully something where we can build out our capacity to refer to our Vermont Cares partners. And also, the Howard Center office in St. Albans is accessible, so we could always make sure that people can receive services at that location. But thanks for raising the question. I want to kind of put that on the list of things we would need to consider.
Thank you.
Yeah, yes, Erin. So that would be my thought too. If the van is parked in a spot where there is a handicapped accessible building that would be a private spot for the handicapped person, the van could still provide the services, but the person wouldn't necessarily have to go into the van if they had a private handicapped accessible spot right there, right where the van was parked.
Yeah, absolutely. And I think that when we're talking about kind of providing treatment services, there's likely a lot more flexibility in that. My experience is that, providing syringe services, folks are, a lot of times just much more guarded with their confidentiality and likely wouldn't go into the Turning Point Center, to meet with an exchange case manager. So I think, sort of depends on which service we're talking about, but excellent idea of making sure that we're really communicating with the building where we're parked. Jackie, I see your hand again.
Yeah, I was just wondering if, would it make any sense to maybe have sort of like a tent space almost outside of the van too, so people don't have to go into a building? Something like that might be accessible to people with mobility aids.
Yeah, that we've certainly talked about that. Even just, I know that Melinda kind of had shared a tent engagement initiative that was going on previously in Franklin County, and I just thought it looked so wonderful. I was really thinking about it for our van project. So yeah, that's a wonderful idea. Just a way that we can kind of expand the service area and have it be more accessible. Just also from like a green perspective, you have to run a generator on the vehicle to keep it at a stable temperature, both in the summer and the winter. So having something that we wouldn't have to heat or cool could potentially be helpful.
Yeah, I just think that it is important to think about, because there's a lot of intersectionalities between these populations. So yeah, I think it would be good to find some way to make the services accessible to people with mobility aids, just to make sure that you're also reaching that population.
Great, thank you.
Any other questions for Erin?
Thank you.
Erin, thank you so much for the presentation, the information. It's super exciting.
Yeah, thanks so much for having me. Great to be here.
For sure, for sure.
Thank you.
She did so well. We'll excuse her from the song list.
I still want to
it
hear her
okay.
sing. But before we do that, so if there aren't any other specific questions for Erin right now, actually, I'm stealing your job here.
That's okay.
I'm going to turn it over to Eric so we can go to the next agenda item.
Yeah. So let's take a few moments for attendee organizations if they want to go around, talk about any upcoming initiatives or new events going on. Before we do that, though, I want to remind everyone that our next meeting is going to be June 7th, right here, or hybrid again if you want to join us via Zoom. And that's going to be the legislative check-in one. So our local, we'll hopefully get a number of representatives from our local elected delegation here from Franklin Grand Isle to give us updates and get feedback from everybody. So, having said that, is there any new initiatives or updates that people want to talk about? Amy Brewer.
You brought up legislators, and so I would just thought I would share in a educational way that there are several tobacco-related bills working their way through the House currently. One that would ban menthol and other flavors is sitting in House Human Services, if you have feelings about that, you should reach out to your legislators. They are hearing from the tobacco and related industries a lot in ways that I cannot match. So I encourage you to try to match the tobacco industry in outreach to legislators. Is that neutral? That was pretty neutral.
Okay. Any other updates, upcoming events?
We'll also continue to plug the fact that we have a desperate need for mentors in Franklin and Grand Isle County. We have a waiting list of kiddos that could use an hour a week of your time. So if anyone is interested in mentoring, please reach out to Karen Communities.
Very good.
I'm going to jump in and
Don't look at me.
I'm gonna jump in and call on Ben because I know you have to scoot in a little bit, and I'm also gonna do a screen share for what Ben is sharing.
Thank you, Melinda. Glad you already have it up on your screen. Perfect. Some of you are familiar a little bit. We've done an event called A Walk in Their Shoes. Just the last couple of years we began it. Now that Samaritan House has joined with CVOEO, we're really kind of partnering with all of our local agencies. So Northwest Family Foods, Community Action, Voices Against Violence at Lori's House. The spirit of this event is twofold. It's a fundraiser, and this year, in addition to CVOEO, we're including Martha's Community Kitchen as a recipient of the funds raised, just because they're such an excellent partner for us. And so in addition to being a fundraiser, it's really meant to be a little bit of an educational day too. We actually walk around town to the places a lot of the clients that we serve go, and highlight to participants, anyone who wants to come walk with us, sort of what a day in the life can be like for someone who's experiencing homelessness, doesn't have a vehicle, and has to get to all these places to meet their needs. And it also highlights all the great service providers doing this work. So on this flyer that Melinda will also drop in the chat, I'm sure, it talks about some of the stops we make. So we walk from Samaritan House over to Community Action, to Martha's Kitchen, to Lori's House, Spectrum, Turning Point. A lot of the places that all of the folks we work with frequent, and there are small tours at each stop. So again, this flyer has registration info. We'd love to have people join us. You can sign up as an individual. You can create a fundraising page. We do encourage people to try to raise $100, but it's not a requirement. If you're not able to raise funds, you don't need to come join us. And you can also sign up as a team. So if your office or your church group or just a group of friends want to be a team and create a team page and come join us, we'd really love to have you. So this has been a small event the last couple of years. We're hoping to grow it a little bit more, and we'd love to see you there. If you have questions, reach out to me or Melinda. She's got a heavy hand in getting this going, as she does with every community initiative. So thank you.
Thanks, Ben.
Thanks, man.
What day is it?
So this is on, Ben, the date is not on here. It's June 10th, correct?
Up at the top.
It says
Slide up.
Oh, is that the top? Oh, sorry.
Okay.
Yeah, slide up to the top there.
Of course, it's up at the top.
There it is. Thank
Ben
you.
designed it.
That's all right.
That's a Saturday.
Very good. And let's see, Jessica, you have something for us.
I do. I have for all of you and the folks that you work with here at First Congregational Church, we have a friend who is a senior lecturer at UVM in psychology. She works with social workers and human service providers. And she's one of a handful of trainers in something called Circle of Security. And I'll read it to you because it will mean more to you than it does to me. Circle of Security is an intervention program designed to improve the quality of caregiver-client relationships and offers human service professionals and caregivers a simple and coherent map for understanding attachment needs and the barriers that prevent us from meeting those needs. So she is trying to bring Circle of Security to health service professionals and human service professionals. And so she's having sort of a workshop at our church that's free on May 20th, which is a Saturday from 10 to noon, to sort of investigate what that might look like as a program. If you are interested, you can show up or you can give me a call here at First Congregational Church. Again, May 20th, 10 a.m. to noon, we'll have coffee and treats. Thank you.
Fantastic.
Thank you, Jessica.
And Matthew.
Yes, greetings. Yes, I just posted Melinda White yesterday about just an event, hosted by Council on Rural Development, which is a statewide planning commission for the environment. They're hosting at BFA May 23rd on a Tuesday from 5:30 to 7 p.m. A youth opportunity involvement for the northwest region of Vermont. So that's all Franklin County, youth from, and everybody wants to participate, in that, I sent you the email link, Melinda White, about that, or, about what it entails, but that's just a reminder that is May 23rd, 5:30 to 7 p.m. at BFA High School. Thank you very much.
Thank you, Matthew. And yes, I'm going to include that in the weekly updates. And I guess it's a good time to mention the updates typically go out on Fridays. They're actually going to go out later today because I will be out of state on Friday and Thursday. So just wanted to let you all know those updates will be coming. If you have any last minute updates to email to be included in this week's, just be sure to send an email to me in the next couple of hours if possible. Otherwise, we'll make sure we get it into the following week next week.
And the link to do that is at the bottom of the agenda, the FGIC partnership at gmail.com. So if you can't remember the link, it's at the bottom of the agenda. Any other updates or anything?
Yeah, a couple of things. Jessica, do we want to advertise? Isn't next week we're meeting with Barry Lamke about housing at First Congo?
I'm not sure when. I'm not sure that meeting time has been finalized, but we can we can put that in the announcement if we get it. I may have been off that rotation.
Okay, all right. I thought, yeah, I can't remember what time it was, but
you might want to mention your community dinner.
yeah. So Saturday night, 4 to 6. We have a fundraising community dinner for our food shelf, either eat in or take out. $7.50, $5 for children under 12. And it's shepherd's pie, full meal with shepherd's pie. So you can either eat in or take out, 45 Church Street in Sheldon, Vermont. And also my second one, while we're talking about legislators, while you call your legislators about tobacco, also please tell them the Senate budget included a $3 million allocation for the food bank, the Vermont Food Bank. The House budget is only $1 million for the Vermont Food Bank. And the Vermont Food Bank basically supplies over 200 food shelves all over the state of Vermont, and their budget and the money that they have significantly affects how us as food shelves can get our hands on the food that we need for the clients that we see. And I'm just now starting to see the increase in clients because of the drop off of SNAP benefits and stuff that happened in March. Well, now here it is, all of a sudden through April, all of a sudden all those families didn't get their extra food stamp benefits, their extra 3 Squares benefits. And so Thursday night, Friday, and Saturday last week, we had over 50 families. In those 3 days, we had over 50 families come to us for food. And it's really getting a challenge being able to get our hands on enough food. So please, the House of Representatives asked them to up the food bank's budget to the $3 million that the Senate required, because that would make a huge difference in what the food bank can do for, and that affects nowadays there's a food shelf in almost every community in the state, so that affects all over the state.
So we have a couple more. I saw Aaron Creeley put in the chat that today from 1 o'clock to 3 o'clock p.m. at the St. Albans Free Library, there is a presentation on Indigenous historical and intergenerational trauma. She also has a link in the chat to the Facebook page, or people can look into Facebook to get that. Thank you for sharing that, Aaron. And then I think Brad had a hand up next.
Linda put my hand up. So we are having the second annual Substance Use Addiction Summit at the Champlain Valley Exposition. It's Friday, August 11th. You can send an email to Melinda if you want to have a booth. Everything is free for booths, and we are a couple things that are significant. We're really looking at trying to look at models that are working in recovery in Vermont and where there is deficiency. So we hope to get a questionnaire out to all of you at some point about what you see as models in your community that are working and resource, and what maybe is lacking, be it getting beds or whatever it is in recovery that we could identify in a positive way so that we can, maybe push the ball a little further to help this. We during the summit we have about an hour and a half of some pretty exciting presenters, and it's a great networking day. If you were there last year, coming out of COVID, a lot of people hadn't seen a lot of people for a long time, and we found that part of it was really significant as well. So we really welcome you all, and it hopefully is a building event, and our goal is to save lives. So.
Awesome, thank you. I also see Aaron put in the chat, so I'm going to read it for people in the room, that there is also a virtual version of the presentation on Friday, May 5th from 10 to noon. You can get the Zoom information when you register with Joanne Crawford at vermont.gov, and I believe that's in relation to the announcement earlier. And there's also a flyer in the chat, which I can get emailed out to people here if you'd like. Thank you, Aaron.
Very good. Anybody else? Is that it for this week? Before we adjourn, again, earlier Melinda mentioned this is since we've started doing the hybrid meetings again not too long ago, this is the second month that Northwest Access has come in and graciously recorded the in-portion part of the meeting here. So we'd like to give a big thanks to Alan. For coming and providing that service for us, and just all the amazing services that Northwest Access provides for the community. So I guess, having said that, there's nothing else.
One more thing.
Oh, one more thing.
Alan, what are you grateful for today?
I am grateful for the upcoming warm weather.
I love it.
Fantastic, and what a good note to adjourn on. So we are adjourned. We will see you all next month, hopefully June 7th. Take care.
Downtime.